All types of surgeries are high risk, high reward procedures and therefore carry some inherent risks. Plastic surgery is no exception. I'm Dr. Srinjay Saha. I'm a plastic surgeon and a clinical associate professor at Apollo Hospitals, Kolkata. And I'll be talking about whether we can have some problems after plastic surgery. And the answer is, can we? The answer is, of course, yes, we can have anything. Anything is possible in life. But do we? And the answer is rarely. We have to keep in mind that when you're doing any surgery whatsoever, not just plastic surgery, three things happen. Number one is what the surgeon, and in this case what a plastic surgeon doing to your body. The finer the skills, the better the finish of the surgery, the better the results. Number two is what you are doing to your own body, and that is, if you are careless after your surgery, you will be getting worse results. But if you do take a good aftercare, you do what the doctor has said, because he or she will have your best results in their minds when they're telling you that, then you have better results. And the third is what your body is doing to yourself, and that means that how your body is reacting. It's neither under your control, not under the doctor's control. Having said that, we need to keep in mind that with a very finely performed surgery and a good aftercare, what I have seen in over 2 decades of experience after doing thousands of surgeries is that more than 80 to 90% of the patients heal well without any further procedures. Vast majority of the remaining patients, they do well with some minor tweaking procedures, if you might call it, some fine-tuning procedures that may be required later, and very, very rarely we do have people who need a little more work than minor tweaks. So what are the most common problems that we usually see in our Indian patients after surgery? I would say it's scars. Indian skins are extremely prone to develop scarring. It can either be in the form of pigmentation or in the form of a hypertrophy. What you mean by hypertrophy is the scar becomes a little thick, and pigmentation is that it becomes black. So if it black and thick is, when the scars heal, is what we usually see. Apart from that, we can also have problems like infection, bleeding, sepsis, hematoma, wound giving way. Rare complications can vary depending upon the procedure being performed. There's no one size fits all in any of the surgeries that we do. So depending upon what inherent medical conditions you have, what kind of a surgery you are getting, how extensive that surgery is, the problems will vary. But having said that, as doctors, we are doctors first. We are not here to sell your surgery. So as doctors, what we first do is evaluate your condition, and we see the risk that you may have and the benefits that this surgery is going to have. And at least personally, and I'm sure I'm speaking for a whole bunch of doctors here, is that we only do the surgery when the benefits far outweigh the risks. Otherwise, we would recommend a hold and a wait and watch before we go in for a surgery, or maybe we would recommend a minimally invasive version which may not be as beneficial, but the risks would be less. Apart from surgery problems, we also need to keep in mind that there can be anesthesia problems, and the most common anesthesia problems, that is post-operative nausea and vomiting, lightheadedness, and body reaction to the anesthetic drugs. But the most common is nausea and vomiting, which may happen in some people. We cannot say beforehand who is going to have that, and it usually happens after general anesthesia. Local anesthesia or blocks are usually safer. We need to also keep in mind that this can happen during a plastic surgery as well.